Welcome, everyone, to this explainer. Today, we're diving into a genuinely fascinating shift in modern medicine. Did you know the average hospital room is actually louder than a busy restaurant? It's wild, right? Well, today, we're looking directly at how 2026 healthcare is finally tackling this. It's honestly one of the most stressful, yet historically overlooked aspects of patient recovery: hospital sound environments. For decades, we focused heavily on the visual and physical aspects of healing. But today, we're going to explore how clinical sound design is being used to actively support the nervous system. But look, to really understand the solution, we first have to plunge right into the problem. Because while hospitals are obviously supposed to help the body heal, they are famously not quiet places. Just imagine trying to rest while your brain is processing a relentless 24/7 loop of constant sensory input. We're talking about the high-pitched beep of patient monitors, the heavy, hurried footsteps echoing down those linoleum halls, startling intercom announcements, the endless mechanical clicks of heavy doors, the rattle of medication carts rolling by, and of course, the piercing tones of critical medical alarms. It's a total recipe for complete sensory overload and severe sleep disruption. And for a patient lying in that bed, maybe in pain, maybe anxiously waiting for test results, the hardest part isn't just one loud sound. It's the fact that their body never gets a full signal of safety. The brain actually treats all this sensory uncertainty as work. It keeps scanning the room, it keeps predicting, it literally keeps the nervous system on high alert, fueling patient anxiety by constantly asking one primal question: am I safe? And when your body is bracing against the environment like that, it is definitely not directing its energy toward healing.
Okay, let's move into section 1, sound, safety, and science. Moving beyond background music.
We are moving way beyond the idea of just playing a nice lobby playlist. What's truly interesting here is how powerfully predictable sound shapes the patient experience. By treating audio not just as some spa-like extra, but as a critical part of the medical experience, predictable auditory input actually provides a real sense of emotional safety and control. It directly influences a patient's anxiety levels. It dictates their sleep quality. It can even modify their perception of pain. And, absolutely crucially, it counters those deep feelings of isolation. That feeling of being completely alone in a cold room full of beeping machines. When we introduce predictable, chosen sounds, we make the medical environment feel significantly less threatening. Which brings us to Section 2, Sleep and Anxiety Research, the data behind clinical sound. Let's actually dive into the data, because this isn't just theory. This is backed by rigorous sleep and anxiety research proving clinical sound design is a solid, evidence-based tool. When we look at systematic reviews, like the Beom study from 2025 and the Liu study from 2026, they both confirm that music interventions significantly reduced preoperative and perioperative anxiety in adult surgical patients. It's an incredibly effective, low-risk support tool. We also see Riedy in 2021 noting that sleep outcomes depend heavily on the specific sound type and the listener. Now, we do have to note an important caveat here from the Feddersen study. While patients report feeling like they sleep better and their subjective comfort improves, objective clinical data is still catching up. We really still need better trials using objective measures, like polysomnography, which are clinical sleep studies tracking brain waves and breathing, just to know exactly who benefits most and how hospitals should perfectly optimize this delivery. So the crucial takeaway here actually comes down to the number 20. Going back to that Beom umbrella review on surgical anxiety, researchers found a massive key to success. Sound interventions need to last at least 20 minutes to effectively downshift the autonomic nervous system, which is our body's involuntary fight or flight control center. Sound isn't magic after 10 seconds. The breath needs time to slow. Attention needs time to move away from the threat. The body just needs a steady 20-minute cue that the immediate future is not an emergency. Section 3. Where ASMR fits in. Social safety for the nervous system. When we say ASMR in a healthcare setting, we absolutely aren't talking about chaotic, high-volume internet trigger videos. We're talking about clinical ASMR. This is a specific style of calming auditory cue, utilizing soft voices, predictable rhythms, and gentle pacing. It's used specifically to lower physical arousal and reduce uncertainty. Imagine a patient waiting for a terrifying scan, and instead of spiraling into panic, they're listening to a caring, soft-spoken 10-minute narration explaining exactly what to expect.
And we know for sure this has a physical effect. A groundbreaking 2018 study by Poerio and colleagues published in PLOS found that ASMR responders showed a measurably lower heart rate while watching ASMR content. For people who experience it, this isn't just a mental distraction. It triggers a measurable physiological relaxation response right in the body.
To build a proper framework for hospital care, it's absolutely vital to understand what sound therapy is and what it isn't. It is uncertainty reduction, nervous system support, and patient-selected comfort. But it is not a medical cure. It never replaces nursing care, anesthesia, or medication. It's not a universal playlist forced on everyone, and it certainly isn't loud, chaotic internet content. Sound therapy supports the heavy lifting that actual medicine is doing.
All right, Section 4, Safe Sound Guidelines. Practical implementation in 2026.
In high-stakes environments, there is a literal life-or-death limitation to sound therapy. The goal is not to cover every sound. Critical alarms must still be heard. Patients need to be able to hear and respond when a nurse enters the room. Sound therapy should soften the jagged edges of a loud environment, sure, but it should never, ever isolate a patient from their care team or mask life-saving monitor.
Furthermore, because personal preference really dictates relaxation, the future of clinical sound is a menu, not a playlist. One person might love the sound of rain, while another finds it super stressful because it reminds them of a storm. One person responds to ASMR whispering, another is highly irritated by it. Hospitals have to offer choices: calm voice narration, musical tracks, nature sounds, brown noise, guided breathing, or sometimes just the option for silence. Good care always begins with patient preference.
So, if you're a patient or a caregiver, here's your actionable playbook for safe usage. Step 1, always ask the care team before using devices, especially in the ICU, where headphone cords can become dangerous trip hazards. Step 2, keep the volume low so you remain connected to your environment. Step 3, use it strictly as emotional support. And Step 4, choose predictable content. No unpredictable autoplay algorithms that might suddenly blast loud ads at 2 a.m., okay? Ultimately, hospital healing is incredibly complex, but I want to leave you with this powerful thought from our sources today. The sound environment can either fight the body or support it. Medicine does the critical, life-saving work, but as we've seen throughout this explainer, sometimes recovery begins with just one steady voice or one predictable rhythm telling the nervous system that you aren't alone, care is happening, and it's safe to finally rest. As we look to the hospitals of tomorrow, we have to ask, will we continue to let machines dictate the sound of our recovery, or is it time we started designing hospitals that actually sound like healing? Thank you so much for exploring this with us.